All right. Hello, everyone. Thanks for joining us today for this Inspirata webinar. My name is Kira Mills, and I'll be the moderator for today. In this webinar, Connie Boone, Manager of Clinical Data Management at Prisma Health, and Biff Curtis, Vice President of Sales at Inspirata, will tell you about an AI-powered end-to-end cancer registry platform. So, without further delay, I will turn the time over to our speakers.
Thank you, Kira. Appreciate the introduction. Appreciate everybody joining us today. My name is Biff Curtis. I'm with Inspirata. I'm honored to be here today. Quick introduction and background on myself. I've been in HIT for nearly 3 decades, in AI-driven solutions for the last decade. At Inspirata, we have native AI-driven solutions that are the fastest, most accurate, and most proven in oncology. We'll talk about vendors making those types of statements and being able to substantiate those a little bit later on in the discussion. Our engine surfaces reportable only cancer cases, extracts and pre-populates up to 120 plus NACER data elements for pre-abstraction, and also surfaces up to 500 real-time oncology data elements to inform oncology operations, improve patient outcomes, acquisition, retention, satisfaction, and associated direct and downstream revenue. We've been serving oncology registries for the last 23 years. We were formerly known as AIM, Artificial Intelligence in Medicine, and it had a previous agreement with NCICR where we were in over 600 facilities across the country. We have client partners that range from 400 reportable cases a year to our largest client that has over 130,000 reportable cases a year, and we serve everyone in between. I'm joined today by the amazing Connie Boone. She's the manager of clinical data management at Prisma, where she handles multiple registries, including oncology. She's the president of the South Carolina Cancer Registrars Association, serves at the Professional Development Board with NCRA, and is involved in volunteering for many other oncology and data related organizations. She's the largest advocate I've seen on LinkedIn for helping ODS's employers find each other, and she's my friend. Connie, welcome. Thank you for joining us today to share your experience and thoughts on this extremely important and relevant topic. And please take a moment to provide a little more information about yourself, your current roles, and your history for those who may not already know you.
Thank you. It's great to be here. I appreciate the invitation. So my name is Connie Boone, and I serve as the manager of clinical data management at Prisma Health. I oversee several registry programs, including cancer, stroke, cardiovascular, and NICU. I've worked in oncology data for many years at the state, facility, health system levels, and I've had the opportunity to see firsthand like how important quality oncology data is to patient care and organizational decision making. Outside of Prisma, I most recently served on NCRA as the Professional Development Board Director. I am a part of GPEC this year moving forward, and I've also been involved with SCCRA and several other registry focused organizations. One of the things that I'm most passionate about is supporting cancer registrars and helping elevate the visibility and the value of our profession. I'm excited to talk about where oncology data is today and where I believe we're headed. So, Biff, again, thank you for this invitation.
Yeah, absolutely. Absolutely. And today, just for the attendees, we don't have a presentation. We're not going to be presenting slides. We want to have an open forum discussion between Connie and I. It's going to be a Q&A. So thank you again for joining. We had a lot of registrants, and I know we have a lot of attendees. So people covering cancer registry, data, quality, all different types of roles, very interested in what the intersection of cancer abstraction and technology looks like in its current state and where it's headed. So to set the stage for our discussion today, Connie, it's no secret that healthcare has lagged behind almost every other industry at leveraging tools that incorporate AI. And AI is artificial intelligence. I think everybody knows that by now. There's just an AI attached to just about everybody's name. And so reasonably so that the healthcare sector has been a little bit slower on the uptake because lives are on the line. But that argument is it's also the same argument for why they should be leveraging these tools. So as most of us know, a safe prescriptive place to leverage AI in healthcare is repetitive administrative workflows. These are daily burdens for different areas of healthcare enterprises, and it's no different for Cancer Registry. Over the last 2 to 3 years, in the face of recent administration changes in our government and the resulting reduction in federal funding to support everything from grants to reimbursement, savvy health systems and facilities are rapidly evaluating and moving forward with these AI-driven tools to create efficiency and improve revenue so they can continue serving their patients while assisting their employees in meeting the demands of doing more with less that everybody's tasked with. So that leads us to our conversation today, where we're going to talk to Connie, who's on the front lines, who leverages technology, who has significant exposure to various tools that are built on or incorporate AI, created specifically for the oncology registry, or that have broader influence and implications for the greater oncology enterprise. So lastly, before we get started, I feel it needs to be just put out there that both Connie and myself believe the expertise and value of ODSs, registrars, and cancer registry support teams cannot and should not be replaced by technology. So that's not what this call is about today. It's about enhancing the work that the quality or the folks in these cancer registries are doing. We want to enhance that and bring that the data forward to the enterprise for consumption and meaningful decision making. So in the spirit of our discussion today, it's going to revolve around the tools that enhance the speed and accuracy at which the work can be done, elevate the status of the cancer registry and their teams within the health system, and solidify the cancer registry status as the single source of truth for the data that's being leveraged by the oncology enterprise. So Connie, let's kick this off. The focus on NCRA. We just wrapped up NCRA in Louisville. I think almost every session had to do with AI in some form at NCRA. So there is a website, NCR's website, talks about the vision, also has some future statements that we're going to dig into today. And we sent a link out to folks if you want to follow along. It's I think it's under About, then Governance, and then the Strategic Management Plan. So talk to us about the NCRA's stated vision of making oncology data matter.
Absolutely. So first and foremost, I'd like to encourage all of the NCRA members and non-members to go and review the S&P in detail, just to kind of, see what NCRA's mission is and how they're driven to help our profession move forward. And so just as we get back to talking about part of this, making oncology data matter, it's about making sure that the work we do as ODS influence the decisions, that we're at the table helping these decisions occur for the patient's journey. For years, registry data has often been viewed as something that it's just been collected for reporting and compliance. As many of you know, today's organizations, they want our data to evaluate screening efforts, understand outcomes, identify gaps in care, support accreditation efforts, and make strategic decisions about the cancer program as a whole. Every abstract, tells the patient's story, or at least part of it. By the time we're done with it, it tells the entire story for the most part. So when that information is accurate and timely, it becomes incredibly powerful. It helps organizations understand where they're succeeding, where there's opportunities, whether it be screening initiatives, gaps in care due to demographics, that type of thing, and then ultimately how they can improve care for the patients overall. So that's what, to me, our data matters, and that's what makes it matter.
Thank you for that description. And, the NCRA is so important because for the registry, the oncology registry, to move forward in a coordinated way and to be able to start to bridge this gap, we have to move forward strategically, and that requires framework and guidance. And I think that's beyond anything else. I think that's what the NCRA is doing a fantastic job with, is providing the framework and the guidance to elevate registrars and the oncology registry. So I appreciate the vision and explaining the vision. I don't think it's a stretch that every person on this call is here because of oncology data. I think everyone's here because they see the value in it, but they're probably frustrated. Like, how do we connect these dots and how do we move forward? I also don't think it's a stretch to say most, if not all of the folks on the call today similarly understand the value of that data. So still struggling to provide the data in real time due to lack of resources. So I think traditionally when that problem has arisen, the thought was I have to go get approval for more team members. We have to throw more humans at this to keep up with the work. But in a field that's seeing a significant decrease in the skilled and certified specialists, leaders are very quickly looking to technology. So again, we shared that link ahead of the webinar. If you haven't found it yet, again, it's ncra.com. Then under the About tab, go to Governance, then the Strategic Management Plan. And we're going to talk through some of the future statements, and because I think they very closely align with that guidance and that framework. Like, how do we get from A to Z? How do we close that gap? And how do we elevate the data and the work that we're doing in the registry to eliminate duplication of effort in multiple areas of oncology, like nurse navigation and clinical research? Everybody's doing case finding. If you can automate reportable only case finding, you should be able to do it once for the enterprise, do it in real time, and share that across the enterprise. So Connie, with the vision that you just shared and what that means to NCRA and yourself, with these four future statements on the 20 to 25 to 29 strategic management plan, I think it'd be very valuable to just unpack each one of these one by one. So the first one that I want to discuss is, as it's stated on the website, we envision a future where healthcare providers and policymakers seek the expertise of cancer registry professionals to help inform all aspects of cancer patient care and related initiatives. So unpack that statement for us and share with us the importance of this statement.
Yeah, absolutely. So this statement, I mean, I think it recognizes something that all of us on this call have known for a very long time. The expertise of what we do for cancer registrars, ODS specialists, it extends far beyond what we do just in abstracting. So we understand that each patient has their cancer journey. We see the diagnosis, the staging, the treatment, the recurrence and outcomes in a way that most departments don't see, right? They just see little portions of each step in their journey. So, at Prisma, we've been working closely at reviewing late stage diagnosis by disease sites and geography, just so we can identify different opportunities to expand screening efforts. In South Carolina, we have different markets, one in the upstate and one in the Columbia area, which is known as the Midlands. And those needs vastly differ. So that's not simply just reporting data, right? That's helping guide decisions that can impact the patient outcomes. As healthcare becomes more data driven, organizations need people like us who understand the story behind the data. So that's where we become so tremendously valuable and bring such value to the programs that we work within.
Yeah, and I think you actually are saying it without saying it. So here's my summary of what you just said. ODSs are the artists painting the full picture of every single analytic case of cancer that presents to your facility or IDN. You're telling a complete story. So you think about it traditionally, you had these data warehouses, and then you get these techies that go in and they're trying to pull data, and you request a report, you request this, there's zero context of the data, and most of the time it does nothing to help. But ODSs are literally pulling all of these pieces of data together from all these disparate resources and telling not just telling the story, but they're putting the story together. So talk to us a little bit more. You mentioned your screening program. Talk to us a little bit more about the screening program and the benefits that both the patients and leaderships are experiencing through the work that your teams are doing. So your teams are surfacing this data, and then they're leveraging it in a screening program. How does that help the patients, and how does that help leadership?
Yeah. So first, you talk about us painting the picture. I think our new credential needs to be the Van Gogh of data. So I'll put that in the little hat for our next credential update.
That's right.
But yeah, so I think leveraging, trying to find these late stage cases and just leveraging the needs of patients. I mean, we all know the earlier that these patients are diagnosed, the better their outcomes are, right? And it's not a one size fits all. So, like I said, the markets differ vastly in what late stage cancers are being diagnosed. In one area, we have high stage cervical cancer, and then in the other market, it's hardly at all. They're all low stage. So, like, what's the difference and where are the needs? Why is one market much higher in one area than another? So that's why the and just show this type of information and the needs of our patients is so important.
Yeah, and I think I tend to think of things, I'm not an ODS. I tend to think of things from the business perspective. And if
Mhm.
I'm doing a targeted screening and prevention program, for me as the business executive, I see this as a way to acquire new patients. And
Mhm.
at the same time, you nailed it. You get them at an earlier stage so you can actually treat the cancer and they have better outcomes. That
Mhm.
improves patient satisfaction. All of that process that you just talked about has direct and downstream revenue that's associated with being able to leverage data, real-time oncology data, to do targeted screening and prevention, and just one patient generates a significant amount of revenue for the healthcare executive. So that's what we're talking about. How do we elevate this work? How do we get the data in real time? How do we get this to the people that matter? And we'll continue to dig into that as we move through the discussion. So again, I'm going to restate it like this. I can't agree more with your statement about needing people who understand the story behind the data. But I'll take it even a step further. You need highly trained and skilled people to be able to uncover all the hidden elements and all the actual context of the story to put them together in a coherent, reportable format for leadership to read, extract value, make quick, extremely important operational decisions. So, yeah, 100% agree there. So, before we move on to the next concept, I know Prisma is a very well run organization, but can you tell me of any one other department or division that's equipped or positioned to do what the cancer registry does, to pull all these pieces of data, understand the context, write the story, and then tell the story?
No. I have, like I said, I have multiple different registries under me, not just cancer registry. And it's very siloed in all the different areas. So it's definitely not the picture that we have in oncology for sure.
Yeah. And it's not a knock on Prisma for sure, but what it does is it highlights the importance and value of the cancer registry and those folks on those teams and what they do. Data is gold. And I know the history of the cancer registry and I know the stigma that's attached to it, that it's a cost center. So why are we going to invest dollars into a cost center? What is that going to do for us? But I think that I would summarize it this way. If your cancer registry is still a cost center as an enterprise, you need to start taking steps to change that. There's tools that are available, there's services that are available, there's support that's available, and that's part of the reason why we're here today is to help bridge that gap. So the next future statement that I'd like to dig into with you a little bit is we believe as more cancer registrars perform fewer manual tasks, a variety of transferable skills necessary for success in the changing oncology community will need to be mastered. Talk to us about some of these skills that ODSs will need to master. What does abstraction on data look like between now and the next 5 years?
Yeah, so that's a great question. I think the future of what we do is to spend less time searching for the with the patient. So more time applying our expertise. We're not just data entry people, not that that's a bad thing. But again, like this credential was not easy to obtain or to maintain, actually. So as technology takes over some of the respective work that we do, I think we'll have a great, well, that will give us more opportunity to just kind of focus on the validation of our data, quality improvements, analytics, helping our organizations understand what the data is actually telling them. So, like I said, we are doing our screening initiatives. That helps expand the footprint of your organization because it tells where the needs are, right? If people, South Carolina is very rural. So, if people don't have a way to get to screenings, that's how you end up with these late stage diagnoses. So again, that's where our expertise comes in, and we can help our enterprises, our or organizations expand. And like Biff said, we're not just a cost center anymore. We're not just taking up money, but we're helping them grow and earn more money. So the need for our knowledge isn't going away. If anything, it's just going to become even more important because someone still needs to ensure that the information is accurate, complete, and that it means something. Our role is evolving daily, but the value of what we do just remains the same. It's all about patient care.
Yep, for sure. And as I think back to the first part of your answer, it sounds like the hope that one day ODSs can truly practice top of license and registry managers can truly manage is within reach now, and it's a
Yeah.
near-term reality. So, there are some team members that currently play important roles in the registry that may feel like they may have less work to do and may become less important. For some of those roles, talk to us a little bit about the importance of reinvesting in your loyal, consistent, the team members that show up day after day. They want to improve, they want to get better. How do you reinvest in those team members if they feel like they're going to have less work to do and become less important when you invest in technology and upskill those people to be able to continue to leverage in your oncology registry?
Yes. So I think this is a prime example. I'm working through this right now. I think majority of us on this call have either been behind, had a backlog, or still currently have a backlog, right? So leveraging these different tools that will help our registries be more efficient and more current in our data, then that allows us to work on our quality portions within our registry as well. So as I was explaining to someone earlier, when you're in a backlog and you're constantly trying to work to catch up and stay current with what you already have, that doesn't give you the opportunity for education to kind of review your cases and kind of see where some educational needs may be. So you're constantly just working to stay afloat. And so that doesn't allow opportunity for the team to grow. So I think leveraging these different platforms allows the continuous growth of registrars or ODS and just allows us to become more analysts than just an ODS.
Yeah, and you think about all the things that have to be done for accreditation for COC facilities. There is no shortage of work to be done, and I would venture a guess that probably the majority of folks, unless they are overstaffed, have overtime. They have overtime, and everybody is just treading water and trying to keep their head above water.
Yeah.
And there's just so much work to do. I don't envision anytime soon, and we'll continue to talk about it, where technology replaces humans. We're too important in oncology. Humans are 100% required, and you don't want to let your good humans go. You want to keep them, you want to upskill them, and you want to be able to continue to leverage them for the better of your program. So you bring up another great point about registry team members not just putting the pieces of the story together, writing the story in a digestible or reportable format, but also now having the ability to tell that story to the key decision makers across the organization. We have today cancer conferences, tumor boards, things like that for forums with a specific purpose. Broadly across the enterprises that you're aware of, is there a mechanism or forum in place today for registry stakeholders who now can have this real-time data? Now we get this real-time data. Is there forum in place to tell that story to those decision makers? Or is that something that as registries move that direction, they need to put, and they're putting these stories together in near real time, they need to take some proactive steps to create these forums with leadership?
Yes, I think we need to use our autonomy and use our voice to bring up these different perspectives and just what we see as registrars in ODS, because not everyone sees all the pieces to the puzzle, right? So that's where, you have to build these relationships. You have to use your opportunities within cancer conference, tumor boards, and stuff, just like you were saying, just to kind of plant those seeds and what we actually can provide and not just check a box for our accreditation, right? We have such valuable knowledge that we can provide to enhance our programs vastly.
Yeah, I appreciate that. As we look to the next NCRA future statement, we envision a future where artificial intelligence and technology will be at the forefront of our profession, and we will be the drivers of this change. Talk to us about your experience using or evaluating AI or real life experiences of facilities you're familiar with that have leveraged an AI tool for oncology registry that was transformational from a workflow standpoint. And how did that impact their perception across the oncology enterprises now being the source of truth for oncology data?
Yeah, so I've had the opportunity to evaluate different technologies throughout my career, whether it be my primary job, whether I've consulted, whether I've been a contractor, whatever the case may be. I've seen multiple avenues within that. So what I've learned is the best tools don't replace our knowledge. It just amplifies it, right? So that allows us time, like I mentioned previously, when we have these tools at our fingertips, that allows us time to dig more into the quality and help build our programs. When our repetitive work is reduced, we're not constantly, reviewing cases to see if they're reportable, not reportable, that kind of thing. So then that gives us more time to focus on the quality. We have educational time, collaboration amongst the different areas within our program, and then supporting just the broad program as a whole, right? So the organizations seeing the greatest success with technology aren't trying to eliminate the people that they have. They're just amplifying them. They're looking for ways. We're always trying to find ways to become more efficient so that we can focus on the higher value work. And then technology should make us more impactful, not less important.
That's right. That's right. And so, when people are looking at, I know a lot of cancer registries, they generally have main line items in their budget. It's people and it's their CDMS. And so they have to figure out, okay, if we're not replacing FTEs, we're not eliminating FTEs, how do these AI tools that are creating efficiency generate revenue for us? And that question is going to get asked a lot. So I don't think that we can stress it enough, is that when you're talking with your leadership, the value is in the data. If you can eliminate three different portions of your oncology enterprise doing the same thing, doing case finding, and you can case find in real time, you just eliminated the need for those other teams to do the case finding. Now you can get patients into a treatment pathway faster for nurse navigation. You can get them into a clinical research study and they don't leave your health system. So now we're, targeted screening and prevention, we're talking about patient acquisition, but now leveraging the data, you're talking about patient retention, getting those patients into a treatment pathway faster, getting those patients into a clinical research study faster, keeps them from going to a competitor. When you can keep the patients, you keep the revenue. You don't do that and your competitor does it, you lose the revenue. So that's how a lot of folks can substantiate that. And I wholeheartedly agree with the amplification assessment and the elevation of effort of the existing team members to perform more meaningful work that can directly impact those outcomes, retention, acquisition, and
Mhm.
finding tumors earlier. So, in complete agreement with you. Now, on the flip side, tell me, have you ever seen or heard of someone attempting to leverage AI, stake their career and reputation on it, only to see the project fail because the vendor couldn't deliver on what they promised? And I don't need a specific example, but
No, yeah.
if you've seen it happen.
I've definitely heard a couple horror stories. I've not personally seen it, but I have, as we all are looking to figure out our programs because our case volumes are growing. There's not registrars, ODS coming out of the woodworks. There's not just, people standing on the street with availability, right? So as we look into these different vendors and look for tools to amplify what we do and to help us keep up with the growth, it's definitely important to kind of do your homework. I've looked into a couple vendors and they're like, oh, we can do X, Y, and Z. But then when you get down to the nitty gritty, they can only do half of X with
Right.
the anticipation to do Y and Z in 5 or 10 years, So it's definitely important to do your homework and get all of the tidbits. Me personally, I'm not like the most tech savvy person, so I always have my sidekick with me so that they can ask the technological questions when I can make sure that my team has what they need to do their job, but somebody else understands the tech side behind it.
Yeah, absolutely. Absolutely. And so I think it's really important to call out so far in the discussion, we've been working on some assumptions for registry teams that they can easily just go out and find a technology vendor that can automate these repetitive workflows like case finding, data extraction, and population and NACER data elements, and whatever the vendor says they can do, they can actually do. So I think as part of the discussion today to help educate the market and the folks that are on the call, I'm just going to add quickly some vendor context here as well to help registry leaders understand the market and how to protect themselves from making a bad decision that could cost them the goodwill they've spent decades building. So as a vendor, for example, and so we work very hard to stay ahead of the needs of the market. So we've seen a lot of noise, heard a lot of noise in the market, a lot of claims that vendors are making, and no way for the prospects, the evaluators to test it other than maybe some reference or something like that. But to help the market cut through the noise, we recently created this web-based tool for facilities engaged in evaluation process to validate the speed and accuracy of our vendors compared to other vendors' engines. So as a company, it's important that you find a vendor that will stand behind the accuracy of their case finding and contractually. So we do that with our clients. We put in performance clauses into our agreements, and I think that you need to require that from any and ask them right up front. Will you put that in the contract? Because that's important. That to me, if I was sitting in your shoes and making an evaluation, that would be a deal killer for me if they would not put performance requirements in a contract. So we also created this tool because Epic and Palantir and these platform AI tools tell folks that they can do everything that an oncology specific tool can do. And we know that they can't, but how do we prove that? And then it gets into this circular discussion, IT directors and folks that take the conversation somewhere else. And well, Epic says that we're going to do this. So now you're 6 months delayed in getting your tool. And so we want to give our prospects a tool that they can be armed to have that conversation. So with our tool that we built, you take 50 reports, go to our website, run your reports in real time against our engine, and then compare our output to what you personally found. So you validated these 50 reports, you know which ones are reportable, which ones aren't, what tumors they are, et cetera. You compare that to our output, and then you can see the speed and the accuracy of our engine. So 50 reports takes us about 11 seconds to run, maybe less than that for 50 reports. So you'll be able to see the speed and accuracy of our report. Then you have the other vendors do the same thing. You compare those, and now you have something apples to apples that you can compare versus what vendors are saying and what platform AI vendors are saying. So it's important for y'all to have tools. For us, for Inspirata, that's the easiest part. This is table stakes. We've been doing this with 99% accuracy for the last 23 years. So if you can't get this part right as a vendor, how can you as the prospect or the end user trust the data that they are extracting is valuable for the abstract? So just a quick point there from a vendor side. So it's, I just wanted to point that out. So on the same future statement, Connie, and referencing back to cancer registries being at the forefront and being the drivers of change, I've seen the following scenario. So I've seen facilities that I've talked with. We've gone through an evaluation process. They say, hey, we're not interested right now. We'll come back to you. But now they come back to us and they say, hey, we found out that an adjacent department is now looking at an AI tool and they want us to use their AI tool, but it's not an oncology AI tool. It's just a general AI tool. Have you experienced this, and how would you suggest that registry teams truly lead from the front in this situation?
So, yes, I have experienced this. It's kind of ongoing at the moment where there's an AI tool that has made their way into the enterprise, and now they have people wanting us to use it, but they don't really focus on the oncology aspect. So they can do one primary site, but they can't do anything else with any other sites. So I think this is where we have to position ourselves as the SMEs or the subject matter experts and just make sure that you're actively participating in these discussions, whether it be, I know not everybody even knows who we are, right? So not everyone has the opportunity to give their input, but this is where you kind of, when you hear about different avenues, vendors, applications that we can utilize to help our team, and you have someone trying to push something on you that's not oncology specific, this is where you start dropping your tidbits in your seeds with your during tumor board, during cancer conference, with your nurse navigators, with your program administrators. You have these discussions, and whether it's just general conversation during the day, you can say, hey, I have X, Y, and Z at my fingertips that can help benefit all of us opposed to just one of us. So, we want to be able to have accurate, timely data. And as professionals, we have to understand the nuances that come with our data, right? And not everyone understands that. So that's where we have to use our autonomy to speak up for that kind of thing and just show why we're so specific and why what we do is very important, and not everybody and their tools can cover, and it doesn't enhance us, but their tools can't provide what we need or what our programs need. So again, that's where we as ODS professionals, SMEs, we need to help lead these discussions.
Yeah, and to that point, like I've seen non-oncology specific tools used to do case finding, and what they really did was just create an automated way to give the case finders all the reports that they still had to manually review. So to me, that's not case finding. That's just running a report and saying, instead of you going and looking for the cases, we found all the cases, all the reports. Now you have to validate whether the reportability, which means you still have to review all the non-reportable cases and review the full reportable cases instead of just quickly validate, yes, that's reportable, move to abstract.
Yeah, that doesn't help with efficiency at all. That just is paying someone to do what you were already doing for yourself, right?
Exactly. It's I've seen it. I've seen it a lot, and it does not create efficiency. So, I'm assuming folks on the call would love to be able to figure out how to get this in front of leadership. And they're just unsure how or where to start or how to get a leader's ear. Can you give us some examples of how you've seen this done, or how you're beginning to incorporate those discussions into weekly or monthly leadership meetings? And what I'm talking about is saying, hey, I have this data now. This is valuable data. You agree that it's valuable data. We've never been able to get this data from anywhere else, or we've never been able to get this in real time. Now we have it in real time. How would you recommend folks start to 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 start those conversations?
Yeah, again, like I mentioned a few minutes ago, so that's where these relationships are valuable when you are in tumor board and cancer conference with your program leaders. And I know all of us don't fall under the same umbrella in our institutions that we work under. Some of us are in a quality department, some of us fall under medical records. I mean, just different things. So you have to find the important pieces to the puzzle and the decision makers to kind of place these different nuggets of information to help utilize our data. So at Prisma, we have been working on this initiative for many years, 3 or 4. So our breast patients, the standard is 60 days biopsy to surgery. So we made an initiative to cut that down to 45 days. We're doing amazing at that. But that all comes from the registry data. We have used our data to kind of figure out where the barriers were that were keeping these patients from meeting that 45-day window, right? So it's in opportunities like this and where you put your plugs in and how you can utilize these different tools so that you can have more timely data. Again, a lot of us are not completely concurrent, but we need to know these different patients that are at our fingertips without waiting 3 to 6 months, 9 months, 10 months, whatever the case may be. So if we have these tools in place, then we can pull the basic information that we need to help with these programs and just kind of elevating them and kicking them off to do better for these patients.
Yeah, exactly. I mean that there's technology out there like ours that when you do the reportable only case finding in real time, that data can be used immediately. You don't need to complete the abstract. And so you have your time to do your timely abstracts and still do take the time that it requires to do the follow-up and all of those things and be able to tell the complete story before you submit the abstract, but still be able to leverage that real-time data at every point along the way when a new activity, a new report comes in and starts to build that story out. It just means more robust and more data that can be used. So let's take a look at the last of the future statements in the 25 to 29 plan. We visualize a future where the cancer registrar will be respected and compensated for their professional role in interpreting the cancer patient's journey into vital oncology data. This is my favorite one, Connie. ODSs have been harvesting oncology data for decades, but the value of the data was always questioned or just set aside due to manual processes and delays in that data. Now that registries can and are leveraging automated reportable only case finding tools, backlogs are becoming smaller, non-existent, and they're abstracting to some degree concurrently with case finding. Does this feel like finally the perfect storm for ODSs to become the source of truth for accurate, real-time, actionable data to inform targeted screening and prevention, clinical trials, oncology navigation, tumor conferences, value-based care billing, and quality and accreditation?
That's a loaded question. So, yeah, I think it's like one of the most important things, conversations that's happening is today, and we have to use our expertise to kind of leverage our value again. And I mean, I think the more that we can add to our programs, show the need for our data, and then just what we can provide, not just as an abstractor or what people see us as data entry specialists, whatever. I think that's where our value becomes more elevated, I guess you would say. And then we become more analysts, which adds to our value, which of course, the more value we can add to ourselves and prove that, then that's how, we can adjust for our pay and that kind of thing. But yeah, I think that's kind of where we're headed. I think we're at a turning point in the oncology data world to where we can start to prove and people understand our importance and what we provide to the program.
Yeah. I agree. I mean, if you can start to provide that data, then you can start to positively impact retention rates and reduce leakage rates and impact outcomes. And, all those things require some measurement as well. It requires a baseline and it requires some work. But I think that that's valuable work to do because if you can justify now that the registry data is being leveraged to inform these other areas and it's leading to $200 million in downstream revenue. How many patients can you retain if you have this if you can get to that point where you're showing that, then that significantly moves the needle for the cancer registry and what they're providing. And I think then you'll start to see the pay scale go up for
Right.
everyone from the top to the bottom or beginning to the end of the registry process. So, and it sounds like for that transition to take place, a few things have to happen. Number one, you have to work with a proven, reputable vendor to ensure the data is both real time and accurate because you can't gain the trust of
Right.
your leadership. Then you have to educate the leadership that the cancer registry data is now aggregated, accurate, and timely. And then you need to set up working groups or leverage existing data teams to coordinate the sharing of the data in a timely manner, whether it's giving someone read-only access to reports that are inside your CDMS to be able to capture the real-time data, whatever that looks like. It's on registry to be able to facilitate that. From your perspective, are there any additional steps besides those three that need to be added to this list to help jumpstart this transformation?
I just, I mean, I think that list covers a lot of it, but I think just as professionals, speaking up, making our presence known, even if it's you don't have the space to speak up on behalf of your counterparts, right? You have a leader and you just need to have that space that you can go to your leadership, your immediate leader, and help them provide the information that's needed just to, make our profession known, make sure that everyone is aware of all the things that we can provide and to help elevate our programs again. Like that. I
Yeah.
think that's the most important. So we're not just sucking up money from your organization, but we are a huge contributor to our organizations.
Yeah, and Connie, you and I we could talk for hours on this, and I know we have more to
Yes.
cover, but I want to leave a couple minutes for Q&A here. So as we begin to wrap up, it seems like the cancer registry market is moving quickly to elevate the cancer registry as a source of truth for the fastest, most accurate oncology data. Switch to a CDMS that clearly incorporates automated AI-driven reportable only case finding, NACER data extraction and population, and the surfacing of as many real-time oncology data elements as possible for fast validation and reducing the number of hours per abstract. Before we start taking questions, please
Mhm.
share some of your final thoughts from your Prisma position, NCRA position, any of your positions, or all of them before we take a few questions here.
Yeah, so I think the future of our profession is exciting. As we've watched our data move from being primarily just reporting requirements, checking a box, to becoming a critical resource for our operational, clinical, strategic decision makings. So at Prisma, I've seen how our data has influenced everything from screening initiatives like we talked about earlier, accreditation activities, quality improvement projects. So, from both my Prisma and NCRA perspective, success will come from balancing the innovation with education and professional expertise for sure.
Yeah, I couldn't personally agree more, and I'm so excited for and fully support cancer registries, the ODS profession, and professional groups such as NCRA. Connie, I love to see your passion for oncology data and your commitment to the ODS profession. You are the single loudest voice on my LinkedIn feed, but it's always for supporting and elevating others selflessly. So the number of people who attended today is a direct testament to your work and your commitment here. and you are so good for our industry and helping close this data gap. Thank you for joining us today, and thank you for everything you do. Kira, I know we only have a couple minutes left, 5 minutes for Q&A. Would you please facilitate that for us?
Absolutely. Thank you both, Biff and Connie, for such a great talk. Like you said, we've got a couple questions that have come through, so I'll go ahead and open up with our first one, which is how is patient data collected, linked, and protected, and what safeguards are in place to maintain PHI and PII confidentiality when AI is used?
Yeah, so I'll answer that from our tool, Inspirata. We deploy our AI engine on your server on-prem, so the PHI never leaves your environment. So we don't store it, we don't use it for anything other than to validate or to surface whether it's a reportable case of cancer or not. Did that answer that question? PHI, PII confidentiality when AI is used. How is patient data collected, linked, and protected? So the way that we integrate is with we have an integration partner. So we do export import to all the CDMSs, but we also have an integration partner where you can do patient matching and things like that. So when a new case is surfaced, they can do a quick validation. I'm happy to. This is not about our tool. This is about NCRA. So if anybody has questions for Inspira, I'll be happy to answer those questions offline. Next question, Kira.
I mean, I think a couple of the other ones are, yeah, more on this larger scale. So, how does, this solution ensure accuracy, completeness, quality while avoiding inaccurate case reporting that we often see with AI-driven registry solutions?
Yeah, again, I'm happy to answer that one offline if somebody just wants to email me or we want to set up time to meet. If there's questions that focus on NCRA and with Connie and what she's trying to do to help the ODSs and that's really what I'd like to focus on here in the last 2 minutes.
Okay. So let's see. Yeah, we've got a larger one just in general about improving the accuracy of demographic data captured at registration to reduce the time registrars are spending correcting patient information downstream. That sounds like something, Connie, you've probably got experience with.
Yeah, so I think that's where we have to use our voice and just kind of bring these inaccuracies or that we find and just kind of that's where we can get these improvement plans together so we can work on these different areas to make our patients information more accurate across the board, like not just for us but across the board, because that inaccurate information affects everyone this patient comes in contact with. So yeah. And I
Yeah,
think back to the other question real quick, where they were asking about validation. That's where our expertise comes into play using these AI tools. That's why we can't be eliminated. Our expertise is still needed to validate what these AI tools are bringing in.
Yep, perfect point. And one last question.
All right, last question is what are the biggest challenges in integrating AI-driven automation with registry software and Epic, particularly for automating data elements such as demographics?
Biggest challenges, I think, just making sure that from an upstream, which is what I consider us as, to the downstream, the CDMS vendors, we need to be able to have good integration. So we'll export data in an XML format if it's the export import type of scenario, but with our integration partner, we're completely integrated with via an API. And so that is a single platform, a single solution. You log into Onco's OWA and you're able to just do the entire work inside of that one application. And I think, that kind of circles back to the whole end-to-end application thing that we started with is if you don't have to log into 5+, you can become more efficient. You can then start to practice at your top of license. There's less bouncing around. All the edits, the QC edits, everything from A to Z is built all inside one single application. So looks like we're at time now. I apologize I didn't leave more time, but felt like that the information that Connie was sharing was extremely important, and we appreciate everybody's time today. Thanks for attending, and any additional questions for Connie or myself, please feel free to reach out to us.
Absolutely.
Thanks for having me.
Absolutely. Thank you for joining us today.
So with that, again, thank you both, Biff and Connie. Thanks to everyone who attended for spending your time with us today, and I hope you all have a great day.
Thank y'all.